Arachnomotor, I always like to say it's what's going to feed around into these sulci, okay? And then we have piemotor. And piemotor, it's the shiny saran wrap stuff. I can't lift it up because this one's starting to dry out. But the piemotor is just going to be this very shiny stuff that sits on the top. It looks like saran wrap. And when it's wet, you'll be able to tell it. You can sit here and do this and it will flex, okay? So if we flip this over, before I take this off, we have the olfactory bulbs that have the olfactory nerve that runs through, our first O nerve. Then you have your optical tract that has your optical nerve. There's your other optical nerve that comes to the optic chiasma. Your next O nerve. Again, pituitary. And since we have this on here, I'm going to show you the trigeminal. Okay, trigeminal. I only had, oh, there's a third section right here. 1, 2, 3, but this is the trigeminal. If we pull this off, you should be able to see the trigeminal down here, and there's a little piece of it. Okay, but it's going to connect back here. Your next O is going to be O nerve, and I'll just go through those while we're doing nerves. Is going to be your ocular motor. So we're going to have our olfactory, optic, ocular motor. Trochlear sits on the lateral side, usually between the midbrain and the pons. Again, these have been pulled off, so you're not going to see them. Trigeminal sit back here, because if we wait and pull this thing up, we see where it should attach. Okay, so trigeminals usually sit right back here, and abducens usually sit on the medulla oblongata. And again, I don't, may have one right there. Okay, hypogloss will come down here. I think you guys have to know that. So it's O O O T O O O T T A.
O O O T T A.
O O O 2 touch A. I'm not sure. We have where the infundibulum is, underneath the optic chiasma. We have mammillary bodies. We have cerebral peduncles. Cerebral peduncles are what connects the cerebrum to the midbrain. You'll have a ventral fissure that has a basilar artery in it, and this was a really good basilar artery. This will be the ventral fissure. If I flip this over, again, you can see the optic nerve connection of the optic chiasma. Here's my infundibulum that's going to attach to my pituitary, and here are my ocular motor. Alright, trigeminal. You want to see how thick they are? That's how thick those trigeminals are. And you have 3 of them. I know how to do this. Okay. We slice them open in half. You have gray matter, white matter. If we cut them section-wise, you see it a lot better. You have ventricles. 1 ventricle, 2 ventricles. Okay? These are the lateral ventricles. I don't care if you call them 1, 2, 1, 2. They're lateral ventricles. Underneath part of that corpus callosum, which is that lateral ventricle, you have a genu. On the back side, you have the splenium. And on the floor, you have the fornix. On this one, yeah, 4 fornix. On this one, they didn't cut it straight, so you can see the septum pellucidum. So again, here's my genu, here's my splenium, and here's my fornix. Here is my thalamus. It's this circle right here. My hypothalamus would sit right about there. I know that my hypothalamus would sit there because my infundibulum connects to it to connect to my pituitary gland. Okay. So, coming out of here, we're going to walk around this pineal gland, come down past the diencephalon, into the 3rd ventricle. And it's not been cut right, so you can't see that 3rd ventricle, but it would be right there. Here's my cerebral aqueduct coming down into my 4th ventricle. Okay? Inside the ventricle, back here by the splenium, I have a little bitty baby bump. That's a hippocampus.
Oh, that's where it is.
And then here is my choroid plexus. That's where cerebrospinal fluid is made. Okay, makes sense. It's in a ventricle, so it can go out through the ventricles and the aqueducts. Okay. If you have this sitting here, this is your superior caliculi of your corpora quadrigemini. Here's your inferior caliculi. Here's the part of your cerebellum, arbor vitae, or the tree of life. Okay. On this side, you can see this part is the pons, or the pyramid, because it looks like a pyramid. Okay. Don't know if you guys have talked about the decussation of the pyramids yet. Okay. So we have the brainstem sitting here, medulla oblongata, which has the pyramid, the pons, the midbrain. All right. The other thing I forgot to show you on this side is when we separate this out, we have the corpora quadrigemini. It looks like 4 little babies' butts. Superior caliculi affect your eyes. Inferior caliculi affect your ears. Okay, and if I pull this up a little bit, you're going to see the pineal gland. It is not a pineal gland. It is not a penis. It's a pineal gland. Okay. If I run my probe down through there, I should be able to come through, and it's not going to go. If I run my probe down through there, I should be able to go through that aqueduct and through my 4th ventricle.
Oh, awesome.
Okay, and it sits right there. Have I hit everything?
That was awesome.
I just was watching.
That's awesome.